Hello and good morning, everyone, or good day, depending where you are at today. Thank you for joining our webinar. Our webinar will be today talking about TMS or transcranial magnetic stimulation. It's a treatment for depression. It's a drug-free and non-invasive treatment for resistant depression. My name is Ina Lee. I'm licensed in marriage and family therapist, and I'm a founder of New Youth Therapy Center and Family Services. We are located in the beautiful city of Valencia, California. The purpose for our webinar today is education about depression. We see a significant impact on people with depression and symptoms of depression due to COVID 19. People with PTSD or trauma, people with anxiety or stress, they have been suffering due to the pandemic. And people that have been living and suffering from depression have been impacted even more. So we would like to provide some education today about what is major depressive disorder, what is depression, and what kind of treatment modalities exist today, and what is TMS treatment, and how TMS treatment is differ from other treatment modalities, what people would benefit from TMS, who qualifies, and insurance coverage. All those questions will be answered today. So please stay until the end of the webinar. We're going to answer some questions and we will tell you about option to sign up for free evaluation in our clinic and maybe even ask some questions. And I would like to present to you a board certified psychiatrist, Dr. Kalpesh Bafsar, who's an expert in TMS treatment, and he will educate you today about TMS and depression. Welcome, Dr. Bafsar. Thank you for
All right. Thank you very much, Ina. I appreciate the introduction. But let me tell you a little bit more about myself and what I do in my practice. I have been in practice for more than 10 years and I am involved with transcranial magnetic stimulation treatment for more than 5 years. I see patients with bipolar disorder, schizophrenia, depression, personality disorder, PTSD, substance use disorder in my clinic. Lately, I am more focused on treatment for the advanced treatment for the depression like TMS therapy, ketamine therapy, as depression can impact your life negatively and it has huge impact on the family, society, and in country.
Yeah, thank you for presenting yourself. So, and if you're ready, I'm just gonna start our presentation.
Yes, can you please place a slides?
So let's do the
Oh,
presentation. Here's our TMS therapy, and it's again, as I mentioned, it's a drug-free and it's a non-invasive treatment. We're gonna talk about why it's a non-invasive and the benefits of it. Again, these are short-term treatment, 6 to 8 weeks only, or 36 sessions, and the benefits again that there's no much of side effect of TMS treatment and insurance coverage as well. So, Dr. Bassar, can you talk about the numbers about depression and demographic related to depression?
sure. Depression is a pretty serious illness and it is widespread in society. As you can see, there is 1 in 15 adults are impacted by depression. So that is like 6 to 7%. And more than 17 million Americans experience one or more depressive episode in their lifetime. So it has a huge impact on the person's life as well as it impact the family, their job functioning, and many of them have miserable life, particularly who have severe major depression.
That's a significant number to know about depression, and it's have been rising right now during pandemic as well, right?
Right. These numbers are from 2017. Because of pandemic, they are not able to keep up the numbers for the depression demographics. So I think it must be 10% more than what we see here.
What we see right now. And that's why we thought that it's so important to do this webinar. And it's going to be a series of webinars about depression and particularly TMS. So people would know what treatment modalities exist nowadays and what are the most beneficial, maybe treatments or maybe a combination of the treatments. But I would like you to tell us more today about what is major depressive disorder, or some people would say resistant depression, because TMS was developed for people with particularly resistant depression. How would that differ, like regular depression, from major depressive disorder?
Okay, in order to understand treatment resistant depression, we need to understand what is major depression. Major depression is a illness which is characterized by the mood disorder and which decrease the quality of the person's life in different field, emotionally, occupationally, in family.
Mm-hmm.
It also brings detrimental thoughts like suicidal thoughts, or they do not see any light at the end of the tunnel. So they are have the miserable they are amotivated, they are refused to do anything, refused to eat or drink anything many of the times. And as a last option, they decide to end their life, and some of them try to commit suicide. And unfortunately, some of them might be successful as well.
Right. And we also
So
talk about DSM criteria, which is like how to diagnose a major depressive disorder. Not that we want people to diagnose themselves, but just to know some of least the basic symptoms of major depressive disorder, right?
right. So DSM criteria requires only 2 weeks of depressed mood with some of the criterias, and it would require five out of seven criteria to qualify for major depression, and it requires only 2 weeks. But let me tell you what we see in our clinic, and you might be seeing some of the therapists are there, so you guys might be seeing some of the patients who might be suffering for major depression for months, if not years. So this definition is very soft to qualify for the diagnosis of major depressive disorder.
Right.
And as you see, the suicidal thoughts, thoughts of dying, death, and many of them try to commit suicide and be successful. So in America, one in 12 person, one person in 12, every 12 minutes, one person commits suicide and be successful. So it is on a daily rate is like 110 to 120 person in a day, 24 hours.
Right.
Last year only 48,000 killed themselves. So suicide is a leading cause of death, 10th leading cause of the death in United States.
Right. So it's a very important information to people to know that the suicidal thoughts or suicidal attempts could be a symptom of depression. And if you or any of your loved one have the symptoms, that you need to be seeking for help, professional help. Right. So, Dr. Basar, can you talk to us today about treatment, a traditional treatment that have been existing and people have been using to treat depression?
Sure. So for major depression, many of the people try with the self-help. They talk to their family. They say, okay, do the deep breathing, go for the exercise, go meet the friends. So those are the self-help techniques they usually starts with. Some of them, when they have the mild depression, they get successful and get out of themselves from the depressive episode. Some of them come to me, or first they go to usually their primary care physician, then they come to the psychiatrist, or sometimes they come directly to psychiatrist. So what we do, myself as well as the primary care physician, we prescribe them happy pills, serotonin, selective serotonin reuptake inhibitor like SSRI, SNRI, and many of the times they work well. Of course, they do have the side effects,
Mm-hmm.
and many of the people with the major depression, they who are not interested in medicine, they directly go for the psychotherapy as well, as behavioral therapy is FDA approved therapy for the treatment of major depressive disorder,
Mm-hmm.
and many of the times it is very helpful.
Right, and usually what we see in our clinic as well too, the combination that we combine with psychotherapy and medication as well have been helpful. However, there are some people that would not either respond at all to the treatment or would have maybe somewhat improvement of the symptoms, right? We still call them like resistant depression. Okay.
Right. So now let's review some of the terminology we use for the treatment response in major depressive disorder. Statistically speaking, this response is a 50% drop in the symptoms on the rating scales like HAMD, Hamilton Depression Rating Scale, or PHQ-9. So 50% drop in the symptoms is called the response. The remission means at the end of the treatment, person has no symptoms of depression. That is called remission. And remission should be the goal of any treatment.
Mm-hmm.
As remission increase the probability of recovery and decrease the chance of relapse with
Mm-hmm.
major depression.
Mm-hmm.
Relapse, as you see, return of the symptoms before reaching recovery. So let's say somebody in the response, but they did not achieve the remission, then there is a chances of relapse. The depressive symptoms come back and it impact their life negatively.
Right. So, as you said, the goal of all treatment is remission. This is what we're looking for. Well, people go to treatment, but there's some numbers that we see for unmet needs, or the numbers for people that do not respond to the first line of treatment. Can you talk more about that, please?
Sure. So as many of the patients get relief or they respond well to the medicine, therapy, or self-help technique, some of them do not. Like as you see here, 32% people do not respond to any drug therapy. So not only one medicine, they say that any drug therapy means more than one. Sometimes they have tried 4, 5, 6 medicines. They have tried switch the cognitive behavioral therapy to psychodynamic therapy. They switch the therapist as well so many times, and still they do not benefit or they continue to feel depressed. So they are 32%, and it translates into the number more than 5 million people in United States only, they have treatment resistant depression and they have the severe depression.
That is scary number, Dr. Bassar. Just to know, in over 5 million people that are suffering now today with the major depressive disorder, that could be multiple different sources and reasons for depression, whether it's environmental or whether it's a genetic. But 32% are resistant for any drug therapy. That could be what side effect of medication, right? Okay, or just a complete intolerance to medication. And 52% of people with major depressive disorder, they don't respond to the first line of treatment. That means you have to take time to work with medication just to see what medication would work, right? This is a scary number, Dr. Bassar.
That's right. So, and the medicine as well, we need any medicine to give at least 4 to 6 weeks time to make it work. So when they do not respond to one treatment and they try the other one, it will take so many months to get the best treatment for them.
Okay, so and that would take time to build it up and see if it's working or not. Okay. Well, it's interesting for us just to educate people about other treatment options that exist to treat the depression. And some of them are ECT or ketamine or deep brain stimulation. Can you talk a little bit about each of them and see what's the we were going to talk about what how the TMS therapy is differ from those treatment options.
Sure. So for those people who do not respond to medicine or therapy, we go ahead and try different treatment like electroconvulsive therapy. There are some of them: electroconvulsive therapy, TMS treatment, and ketamine therapy. Those are FDA approved. Deep brain stimulation, left vagal nerve stimulation. There are others as well, like neurofeedback, biofeedback. Those are non-hypnotherapy. Those are non-FDA approved treatment for the depression or mood disorder. So let's see electroconvulsive therapy. Electroconvulsive therapy, they have been administering this therapy treatment for more than 100 years. It was approved in 1989,
Mm.
and now they use a sophisticated instrument. They, in order to administer ECT, they need to go through the anesthesia, and they administer electric current directly to your brain, and it stimulates whole brain. So when they stimulate whole brain, there are some of the side effects come from that, like cognitive side effects, memory loss. They have the side effects from the anesthetic medicine.
Right.
Then the
Uh,
next one,
they
go
can't
ahead.
drive. They can't drive home by themselves. There's somebody have to pick them up because um, the side effect or impact could be significant from ECT therapy. Is that right?
That's right. And many of the times they are hospitalized or they have at least partial hospitalization for a
Mm-hmm.
few days.
Okay.
We have the other therapy, ketamine therapy, S-ketamine nasal therapy, which is recently approved by FDA for treatment of major depression disorder.
Mm-hmm.
Uh, we in our clinic we administer ketamine therapy, and we offer ketamine assisted psychotherapy as well, and we have pretty good results with that one as well.
Correct.
And then we have TMS therapy, that is FDA approved for treatment resistant depression. So to qualify for the TMS therapy, they have to fail at least one antidepressant medicine
Mm-hmm.
to qualify according to the criteria. But insurance company, commercial insurance company, use their own definition of treatment resistant depression. Like Blue Cross insurance, they want them to fail at least four antidepressant medicine plus two augmentation therapy. So it depends on the insurance, and they are payers. So we need to work with them, and we work with them, try to get authorization for our patients.
So this is good information about the qualification, which we're going to talk about later on, the insurance qualification. And as you're saying that they have to be diagnosed with major depressive disorder, they have to fail a minimum of four antidepressant and then three augmentation medication as well too. Is that correct? But insurances do cover TMS treatment because it's FDA approved treatment. FDA meaning that research has been done and they see a significant result from the treatment. Can you talk more about deep TMS for depression? Just a kind of like brief overview. What is TMS? So we're gonna present this information
Okay.
to people.
Deep TMS, brainwave TMS, is transcranial magnetic stimulation therapy. In this therapy, we direct magnetic pulse to specific region of the brain, which is responsible for depression. And mainly, it is a left prefrontal cortex. Left prefrontal cortex has hypoactivity or less activity with in person with a depression. So we try to stimulate that area, and left prefrontal cortex is connected with several other areas which are associated with the depression. And when we stimulate left deep left dorsolateral prefrontal cortex, it either stimulates or inhibits other areas of the brain which are responsible for depression, and correct that. So the way I kind of explain to my patient that it reboot or reset your brain.
Mm-hmm. And So we call it, we tell people as well too. It's like kind of activating the engine of your brain that haven't been working well, or make enough connections for the neurons, and just continues to work even after the treatment have been completed, right? And there's some history of TMS treatment that it's not. I mean, it's innovated in the United States. However, that's have been existing for some time, right, in different countries in Europe as well.
That's right. They started this, brain stimulation through the electricity, like electroconvulsive therapy, starting from even 1900, 1979. It approved by FDA. The same thing with uh, the Dr. Barker from the London, who started TMS treatment for the neurological disorder in 1985. In 2000, Brainsway come up with his Edge coil with the deep brain stimulation, uh, deep transcranial magnetic stimulation, and they they have made this available for the research in so many university centers like UCLA, and it finally got approval in 2008 by FDA for the treatment resistant depression.
Okay.
And recently, Brainsway got the clearance from the FDA for the treatment of obsessive compulsive disorder.
Yeah, so the Brainsway, I guess, is the only company that has offering FDA-approved treatment for depression and then for OCD or obsessive compulsive disorder, right?
That's right. And for obsessive compulsive disorder, they use a different coil. As you can see in this picture, the yellow coil, that is they use for a yellow helmet,
Yeah.
and they have the different kind of coil. We do not have that available still in our new therapy. We treat them for the depression using this blue helmet.
Blue helmet. So yeah, this is on the picture how it looks like. We're gonna talk about the sensation, or even possible like the treatment, how it looks like. But how can you explain, Dr. Bafsar, how does it work? What does the process looks like?
Okay, so as you can see in the picture, there is a TMS machine with the helmet. Patient is sitting on the comfortable chair. Doctor is administering the treatment,
Mm-hmm.
and this machine is connected on the back wall with the electric plug. So electric current goes through this machine, goes in the helmet in the copper coil, which creates the magnetic pulse, magnetic field. And magnetic field penetrates our skin, scalp, and reach the brain to the neuron, and it depolarizes neuron or stimulate the neuron.
Mm-hmm.
Depolarization is a scientific word for the stimulation. So it stimulates the neuron in the left dorsolateral prefrontal cortex. That is the mood centers, and which is responsible for major depression.
So it's kind of like a magnetic stimulation for people, just to stimulate the activity of the brain, right?
Right. So electricity from the wall converts into the coil into the magnetic field. From magnetic field, it goes into the our brain. It penetrates the skull and reach the brain, and it converts back into the electricity. Our brain is electrochemical organ. We can either stimulate through electricity or through chemicals, like what we use the medicines. It stimulates parts of the brain through chemically.
Okay. So it's producing kind of like an activity in the neurons, a neurons connection that haven't been working well, as I said, the not enough production of whether serotonin or dopamine, for people to feel happier, right? And then which the same kind of neurons, they are responsible for even for anxiety. So concurrently, when you treat depression, you can treat as well an anxiety. We can see significant reduction in depression and anxiety at the same time.
That's right. And in Brainswave Deep TMS technology, we use the H coil, and it penetrates brain up to 1.6 inch below the skull, while a surface TMS figure 8 coil which they use in the Neurostar machine,
Mm-hmm.
and which penetrate only zero point 0.6 inch below the skull. So, and as our mood centers are located deep in the brain, there is more chances that they get better with the deep TMS rather than surface TMS.
So yeah, you were talking about, so it's a deeper. That's why it says deep TMS versus people would might be able to see repeated TMS, which is the superficial, as you said, with different companies like Neurostar. And so, can you tell us more information, just for education purposes, how to compare those brainwave
Sure.
TMS?
Yeah. Brainsway is the only deep TMS treatment. Other Neurostar, MagSteam, MagVenture, Neurosoft, and there are some others as well came out recently. Those are all superficial TMS or surface TMS. And as you see that it can penetrate only zero point 0.6 inch below the skull, while deep TMS machine with the brainsway machine can stimulate the neurons up to 1.6 inches below the skull. So it can stimulate wider area of the brain,
Mm-hmm.
wider and deeper area of the brain.
Mm-hmm.
And and that's how it is more effective than the other machines, other TMS treatment.
Okay, technology as well too. Yeah.
And as you see that, as we mentioned earlier, it is clear for brainswave is only machine cleared for major depressive disorder and obsessive compulsive disorder. Other machines are only approved for treatment resistant major depressive disorder.
Right. So it's a kind of like cutting edge technology as of today that is FDA approved for both treatment MDD and OCD as well. So these are very important, I think, numbers to talk today and to pay attention to the efficiency of treatment for depression. And we want to know the remission because you explained today early what remission is. And we're looking for a remission, a high number of remission, right?
Yes. Again, the remission, as I mentioned earlier, remission is a complete uh, decrease or absence of depressive symptoms. That is called remission.
Mm-hmm.
And as you see here, the number, brainswave deep TMS and medicine cause 60% remission rate versus only medicine 11%. So that is significant higher number with the brainswave TMS machine. And it works together, brainswave TMS plus medicine,
Okay.
right? And again, there is a second number, brainswave TMS plus medicine, 67% remission rate, sorry, response rate. And surface TMS plus medicine has only 44% response rate. So that also like a 20% more response rate with this brainswave machine
Braithwaite.
than the surface TMS, Neurostar machine.
Those are very important numbers. So 67% or even higher we see in our clinic. It's about over 75% of people having a very clear response rate, significant reduction of the symptoms. So some people even eliminate depression. There's a possibility of eliminating a depression at all. And as you can see on the left, the numbers after 20 sessions, you can see the response is 65%, over 65, and after 30 sessions, it's 70, over 72%. And it's important to say that the whole treatment we're going to talk about is the whole treatment. It's only 36 treatment sessions within 6 to 8 weeks. Is that correct? So 67 was over 67% right now. I think it's even more and higher. That's a significant number for people uh, that have been suffering for resistant depression, that do not respond to any type of treatment for many, many years, right? They went to the treatment, psychotherapy, they took medication, and there's not much improvement. So within 6 to 8 weeks only, they can improve their life or their symptoms. Okay. So,
Okay, so okay, let's see how we administer the TMS treatment. It usually Second session onwards, it lasts 20 minutes, 20 to 30 minutes,
Yeah.
and we administer 5 days in a week, a weekend off, and we administer for 6 to 8 weeks. So 30 to 42 sessions is required depending on the insurance they authorize and depending on the response we administer. If they respond well with the 30 treatment, we do not administer 42 treatment.
Mm-hmm.
So, and first session is little longer. It is a 60-minute session during which during first session we doctor measure the different measurement of their head. They try to find out where to apply magnetic coil in the head on the head and how much current, how much and what is the strength of the magnetic pulse we use to benefit this individual. So it is TMS is individualized prescribed treatment, and everybody would have different area of the brain we have to might have to stimulate, or we might have to choose a different current for different individuals.
Okay. So the whole treatment takes between 6 to 8 weeks only. So what patients would have to just commit to is 5 days per week to come.
5 days per week, and between the treatment they can go back to work or they can go home. They can drive and come for the treatment and drive back home or their work.
Oh,
So it doesn't cause any alteration in their mentation. They do not make them confused. They do not lose their memory. They're alert and oriented during treatment. Many of the people watch Netflix in my clinic, and some of the people read their book or watch their social media on the telephone.
right. The patient is sitting, for example, in our clinic and playing games or watching Netflix or listening to music. And some people even meditate and use this time to recharge themselves. So the whole session is about 20 minutes. And within 20 to 30 minutes, the person can drive home or even come back to work. Uh, the commitment, though, is 5 days a week for 6 to 8 weeks. What I'm wondering again is what do you see as a general common pattern of improvement in patient symptoms? For example, in our clinic, we see in 2 to 3 weeks, people completely change. They start to feel better. They start to dress up, smile. There are significant people report to us that communication is better, relationship is better. They start to see colors as well and taste, of the food. What do you see, Dr. Buffett?
That's right. It is rewarding to see the positive change in their life. Many of my patients get notice that they um, improvement in their sleep and appetite in 2 weeks. They feel motivated. They try to go for the walk, try to socialize, try to meet other people, and started smiling, laughing. When there's quite a few people come with this stoop posture and they seem to be erect after 3 weeks, 2 3 weeks.
Right. But it's important for people to know that the whole effect will take if they will take the whole treatment by FDA guidance, which is 36 treatment sessions, and that usually goes in between like 6 to 8 weeks, right? But what's the side effect, potential side effect of medication?
Uh, Side effects are very mild to moderate, and it is a session limited only. So if the person has session today, they might have the some of the side effects like headaches, scalp discomfort, spasm of the facial muscles, lightheadedness, only for that treatment, and after a couple of hours it resolves the next day. Or and with the continuity of the sessions, let's say after 2 weeks, they might not have any of the symptoms.
Okay, so it just
And
stops after the treatment itself, and it could be just not really pain. It's just a little scalp discomfort, right? That people describe.
And that's right. Very rarely there is a incidence of seizures, manic-like episode, or hearing loss, but they are very rare. I think the seizure episode is like they mention in the brainswave literature is 1 in 10,000 treatments, so it is very rare.
Okay, so we have to screen carefully for people with maybe history of seizures or things like this, right?
That's right. And if they have the seizure disorder, or if there is a strong family history of epilepsy, we refer them to the medical doctor, make sure that they have been treated for the seizures, and then they come back to the treatment.
Correct. And as I can see, your numbers here is that even at 0.2% of seizures just throughout the whole history, right?
Right.
Improvement.
So it is very rare. I have treated like more than 300 people. I never saw anybody with the seizures, but we keep the all those medicines and stuff like that in case that happens.
Right. And so, can you talk about you said here no long-term side effect really and no systemic effects.
Yes, there is no study about the long-term side effects of the TMS, and it would require because TMS came out in 2008, so there is no study for that yet. But nobody reported to me that there is any long-term side effects like cognitive deficits or memory problem or even hearing loss.
Okay.
And that's why we give them the earplugs to prevent the hearing loss.
Right. And so this is good to know about for this for even people that have a lot of side effects and intolerance to medication that they can improve because of this or psychotherapy is not enough by itself. So this is good might be a very good option, right, for those people.
That's right because TMS is targeted treatment. We stimulate targeted area of the brain only, so it doesn't have that many side effects. While a serotonin receptor, dopamine receptor, norepinephrine receptors, they are widespread in our body, even our GI system, vascular system, sexual system. So there are so many side effects, unintended effects of the serotonin and norepinephrine medicines on those organs, and
Okay.
that's why they are unable to tolerate those effects, side effects.
Okay. So, and what's important, I think, also to know for people that it's FDA approved for in United States only right now, and it's covered by insurance for major depressive disorder, right? As we talked about it, we talked about what major depressive disorder is, but what are the criteria to meet insurance criteria, which you said is they have to try and fail or they have severe side effect to minimum of four antidepressant. Is that right?
That's right. It depends on the insurance. Blue Cross has stricter criteria. They have to fail four medicines plus two augmentation plus continuous therapy. While the Medicare follows the CMS and APA guidelines. If somebody has Medicare, we can start the treatment with only one failure of the medicine, and that
Mm-hmm.
is treatment-resistant depression. So Medicare is very lax. Other private insurances are very strict, and they need the authorization process, and it takes some time, but it can be done easily.
Okay. And what do you do for people that do have depression, but they're not qualified? They're not being not diagnosed by major depressive disorder. It's still a depression, lesser depression. Or people with PTSD, people with severe anxiety disorders, people with high stress level, or even maybe some chronic pain. What do you recommend in terms of off label treatment?
Sure. So this TMS treatment is in United States approved for only two conditions: treatment-resistant depression and OCD. But in other countries, European countries where regulations are lax, they it is TMS treatment is approved for schizophrenia, anxiety disorder, PTSD, even the stroke rehabilitation, smoking cessation. So it can be used for so many other purposes. It is not actually FDA approved in the United States. So if you have the major depression and PTSD or generalized anxiety disorder, it can benefit the symptoms of the PTSD and generalized anxiety disorder as well.
Mm-hmm. So it's the comorbid treatment, the comorbid diagnosis. They have a chance to improve it, both at the same time. The anxiety, or even PTSD and depression, because they kind of come together, right?
And that's right. And some of the symptoms of PTSD and depression are overlapping. So when we
The off-label treatment, if it's not covered by insurances, uh, there's some financing is available, or financial plans is available, and people would like to get more information about it. they would need to reach out to our office to ask some questions, but just wanted to give you some idea and not to lose some hope if you would like.
Or they can use their health saving account for the treatment as well.
Correct, correct. And also, it's important to know that there's some cognitive improvement in the functioning too, right? Because it could be even treating some ADHD at some point. So you see even ability to pay attention and focus better. Is that right, Dr. Bassar?
Yes, yes, yes. They in the European countries they use this for ADHD as well, and our prefrontal cortex is involved in executive functioning, memory. So certainly it improves that by strengthening those area
Right.
of the brain.
So there's a many benefits for this deep TMS treatment, but again, in the United States, FDA approved and insurance covered. But as of right now, it's a major depressive disorder. Okay, and who are qualified for this treatment, or maybe who are not qualified for this treatment? Are there any contraindication for?
There are not absolute contraindication except one, that is a cochlear implant for hearing. That is a uh, device with some metal and it is deep into the inner ear. So that is only absolute contraindication. There are person with the pacemaker, person with the coil in their brain, magnetic clips in their brain. Those are the relative contraindication, but now they are not using metal clips in the brain. Lately, they have been using non-metal clips. So we have to evaluate them, and it is depends on the case by case.
Okay.
If they have the magnetic, I mean, some artificial joint, like shoulder joint and those sort of stuff can be contraindicated, and we need to be very careful about that.
Okay. So it's for adults. Usually it's for people over 18-year old, and no metal in the upper part of the body. Is that correct?
That's
So
right.
maybe not.
And they approved for the more than 18 years adult population, but some of the TMS administrators, they have administered this treatment on the minor as well, and it was very beneficial to them.
Right. But the dentures are okay. I hear dentures
Yeah,
are
dentures, metal filling in that tooth, they're okay.
they're
We
okay.
do not want them to wear the earrings, metal earrings, particularly during the treatment.
Okay. So we wanna evaluate and see what might be even better, even for peacemakers, for example. That there's some might be contraindication, but there's some might be cleared as well. We would have to contact and consult with your doctors, right? And what about the current substance use? If people have currently using substance use.
I think they are less likely to benefit from the TMS treatment, so we advise them to stop or at least slow down and then administer treatment, so it could be more beneficial to them.
Mm-hmm.
So if they are actively abusing and out of control, I do not think that they are appropriate clients for the TMS treatment. They would not benefit.
Okay. And then what about pregnancy? Other people with pregnancy would be.
Pregnancy is not contraindicated to TMS treatment, as you might know that all the medicines falls into the gray zone
Mm-hmm.
regarding safety in the pregnancy. So no medicine is approved by FDA to use during the pregnancy. And I'm talking about SSRI and SNRI. They are not approved in the pregnancy. So certainly TMS can be used and there is no contraindication for that.
Okay.
And we use the magnetic energy pulse. It is not a X-ray or stuff like that, so which can cause damage to the baby.
Okay. So it's just a magnetic pulse to the brain. So we have a little bit of time left. I would like to maybe to give us uh, one example of a case, a real case that you've treated, and tell us about the outcome.
Sure, sure. I have treated so many of them and I have so many success stories. But one of the success story I would tell is the patient name is Julie. And so we got our machine in 2015. We started treatment. Then one day I was rounding in the nearby hospital,
Mm-hmm.
and one of the doctor approached me. He
Mm-hmm.
told me that my wife is suffering from depression, unable to work, and she's RN, by the way. And she stopped working a few years ago when she started having depression. She tried so many medicines without success. She even have intolerable side effects of the medicine. So, and he was interested in getting this TMS treatment for her. Actually, his wife also researched on the internet and very comfortable getting this treatment. So we got the psychiatric evaluation, medical evaluation, lab works, and stuff like that. We approached the insurance. Insurance quickly approved her treatment, as insurance also knew that she has tried so many treatments. She saw so many psychiatrists, psychologists. So they approved the treatment. Within 2 weeks, she started smiling, laughing, going for walk. And after completion of 6 weeks treatment, she's referred to the psychologist,
Mm-hmm.
and I kind of lost the touch of her.
Mm-hmm.
But after 1 year, doctor meet me again in the hospital, and he said, "There's a good news." I said, "What is the good news?" So Julie went back to work in the nearby surgical center, and she's working full time now.
Mm-hmm. Okay.
So that is a success story. And so TMS can change your life positively.
Awesome. And so we have some questions with Dr. Bassar to answer. We have a little bit of time that we left for the questions. And there's some questions came out here. It's will TMS treatment help eliminate the use or lowering the use of medication?
Sure. So what TMS does is that it reset and reboot your brain, so it can become more sensitive to the serotonin and norepinephrine medicine, and then we can reduce the number of the pills or even reduce the dose of the medicine. So
Okay.
certainly it can be helpful to with that intention.
All right, so they can you reduce medication, or some people that we even can see that after the treatment, reducing the medication, or even might be going towards eliminating medication with the plan. But you have to consult with the doctor or psychiatrist, right, regarding that treatment plan.
That's right. Yeah.
Okay. Another question that we have is from Lisa de Guzman is, can TMS help those dealing with hoarding issues?
I do not have any experience with treating this patient with a hoarding issue, but as the hoarding issue is like obsessive compulsive disorder, or it was in DSM-4. Hoarding disorder was a part of the obsessive compulsive disorder. So I believe that it can change their habit
Hmm.
and positively, impact this hoarding issue. I mean, reduce the hoarding issue.
Which is part
I,
of
I
the,
never treated for that, so I do not have first-hand experience.
so as far as I can see, the hoarding issues might be possibly a sign of anxiety. So anxiety by itself, it's a chemically impacted, can be improved possibility with TMS treatment. But as far as we know, the hoarding can be treated by behavioral therapy. Is that right?
That's right. And hoarding issue is a kind of the part of the obsessive compulsive disorder. So if we get that new machine with this new helmet, possibly they can benefit. When we treat the obsessive compulsive disorder, they get better with the hoarding issues.
Right. So along with medication and psychotherapy. The next questions here is so is that harmful in any way? At what time of depression is this treatment helpful, and also is it harmful in any way? I think we talked about being side effect of medication, not really
Uh-huh.
much side effect, but is at what point of depression is the treatment helpful?
What? I'm sorry.
At what point, at what time of depression is this treatment is helpful?
Particularly, this is approved for the treatment-resistant depression, mild and moderate kind of major depressive disorder gets better with the psychotherapy plus medicine or only psychotherapy. So I would try to recommend this treatment for the severe depression. It is causing trouble with their functioning, daily functioning, their hygiene, their occupational functioning, then I would recommend the TMS treatment for those people.
Right. And also, as we talked about resistant depression, at what point it's like you have been receiving treatment on a regular basis, traditional treatment, medication and psychotherapy, and you have tried it and nothing, no improvement or no significant improvement. So this is a time when you have to evaluate and go to your psychiatrist, or Dr. Bassar is going to be available in our clinic to evaluate you for free. And we're going to talk about the free evaluation at the end, just to see if you gonna qualify for TMS treatment. Another question is, Dr. Bassar, is does anxiety cause depression or depression cause anxiety?
The way I kind of explain to my patient, and depression and anxiety is like a coin. If it is one there, and depression is there, there is significant anxiety as well, because all these mood centers, left dorsolateral prefrontal cortex, they are emotional center, and they are somehow connected with the amygdala, and amygdala is a center for anxiety. So it reduces the activity of the amygdala by stimulating dorsolateral prefrontal cortex on the left side. It reduces the activity of the amygdala and reduce the symptoms of the anxiety as well.
Okay. Well, thank you. And here, a last question I can see here is first line of treatment, including drug therapy or talk therapy only. So first line of treatment.
This thing, and it can improve. So before they come to the even doctor, they try to help themselves to come out of the depression
Okay.
when they have the mild depressive symptoms.
Right.
But TMS is not kind of not FDA approved as a first line of the treatment. I hope they approve for that, and then we get the TMS treatment to everybody to start with.
Right. Because it's very, very effective. Um, no, another question is that question's coming from me because I don't see any more questions here and in the chat. But question from me is can people that have received TMS treatment come back for repeated treatment again and receive another TMS treatment?
Sure. So our goal for the treatment in the TMS is the remission. So when person achieves the remission, they might not have any depressive symptoms, or there is less likelihood of relapse, and they might not have those symptoms again for after 1 or 2 years. They might develop again symptoms and they might come back. But some of the patients who do not get to the remission, but they have only response. So those people with the response, they might again see the decline in their functioning, increase their depressive symptoms, decrease energy. Those people can come back after 6 months and receive the treatment again. And insurance usually approves, authorize again repeat treatment if they have a good response with the first treatment.
Right. Okay. All right. So thank you, Dr. Bafsar, for this is very interesting and educational webinar. I just want to summarize everything that we talked today. Is that TMS treatment, particularly deep TMS treatment with brain sway, is very, very efficient and has a very high remission rate. It's drug-free, it's non-invasive, really not much of the side effect of medication, painless. People can drive home from it and come back to the treatment again. It takes about 6 to 8 weeks only. Within 6 to 8 weeks, there's a hope that this symptoms would improve a lot significantly, or there's a possibility even elimination of depression. People have to commit to 5 times per week, right? The treatment session is about 20 minutes, the regular treatment sessions. The first session is about an hour for the evaluation. But in general, it is covered by insurances if they meet a criteria for major depressive disorder. And however, after the whole treatment, we see a significant improvement even after the second or third week. The whole, of course, effect should be taking after 36 sessions. And what we see as a report from our patients in the clinic, that they change their life, the quality of their life. They start to communicate, smile, again, see colors, taste food, have greater relationship, enjoy their work, enjoy their walk, enjoy their food. So it also can be helpful uh, for people with some disorders that are off label, right? Could be treated off label. It could be lesser depression if it's not major depressive disorder. That it could be PTSD because a lot of times, or anxiety disorders, it could be comorbid with depression. So which one comes first? I don't know. It can be going together. So those could be very very helpful. And for off-label treatment, people can reach out to us and ask questions. Financing is available. There's a special credit card is available that covers TMS treatment. Um, if you're gonna have questions, uh, reach out to us. So for those people that are interested or have any questions, I'm just gonna go with a last
Last slide
slide
of this presentation.
about the presentation, how to reach out to us. So we offer free evaluation for people with depression for TMS if you qualify or not. Um, if you have any questions and would like to submit your request for the free evaluation, you can call us at 818 600 2034, or you can submit your request by going to our website at www.newutherapy.com, and you can either submit a request through make an appointment and state that I would like to schedule free evaluation, or there's a self-assessment as well too, that you can go through the self-assessment and see if you self kind of qualify. But again, to submit a request for free evaluation, please call us or please submit through the website a request for the appointment. Well, thank you very much, you guys, for joining us today. If you would like to follow us on the Facebook, just go to New Therapy Center and just follow us for any updates, for any future webinars, for any future questions that you're going to have. We thank you for joining us and for your time. Thank you very much, Dr. Val.
Okay, thank you very much, guys. Have a happy holidays.
Okay, have a nice day. Thank you.